Coming up next on House Calls with Mental Health Matters with Marty. Menopause. Is it affecting you women? Stay tuned. What's up, everybody? Hey, welcome to another edition of House Calls with Mental Health Matters with Marty. And listen, my name is Martina Sellers, and I am your mental health hygienist coming to you live and in living color from Southern California. Listen, this is going to be a great topic. So listen, while you're there, let us know what's going on. Let us know if you're out there. Let us know where you're from. Put some people in the chat. It is Welfare Wednesdays. If I was back in my clubbing days, we got in the club half price. But since I'm at home, it's just we're not going to give you half price advice. We're going to give you the full advice with that. So let me start by saying every time we do this show, Mental Health Matters with Marty, and House Calls featuring Dr. Allen and the whole amazing group of doctors that we have. This is meant to supplement. This is not a replacement for your medical doctor's visit or your psychiatric visits as well. We are to supplement what you are already doing. If you are experiencing any type of medical or psychiatric emergency, we definitely want you to go to call 911 or go get you an appointment with your doctor ASAP. But since you're here, you might as well let us know you're here because we got a great show out there for you. Listen, I love all of you. Listen, let us know you're out there alive and popping. Cherie, what's happening, darling? How are you? Good to see you, definitely. And yes, Arvella, good to see you as well. Let us know you're going out there. Paula, how are you, darling? But listen, I want to bring on our resident doctor herself, of Miss House Calls herself, none other than Dr. Gwen Allen.
Hey, Marty.
Dr.
Nice
Allen.
To be back.
I know that's right. Listen, we are doing this. Can you believe it?
We are doing this. It is lovely. I remember back in the day, we were sitting in Oakland, wondering what we were going to do with our lives. And now we're sitting here on podcasts and Facebook Lives and doing our thing.
Listen, this is how we do it.
I really appreciate you, Marty, for getting me into this because, I'm kind of shy. No one really knows about that. But
No, but you know what? For those who don't know, Dr. Allen and I went to UC Berkeley together. Go Bears. We've been knowing each other since we graduated from high school. And she is not just
not high school. I'm younger than him. College.
But, Dr. Allen is the sister from another mister, and I love her to death, and we go back, and I love that she loves our community. Listen, Dr. Allen, you've been volunteering since we were freshmen at UC Berkeley. Yes. Marcia, what's going on? That's right. We've been doing this, and you inspired me when I was young, and when we were both young, and because we did a lot of volunteering in the inner cities, high schools, and all that, because we wanted to make a difference in the lives of those that we were around us then, and we're even doing it now. And so, hey, salute. Listen, how was your Easter? How was everything for you?
It's really good. I mean, I know a lot of people are mad that COVID is here, but I love it. I love the freeways being empty. I love being at home by myself, a couple of family members there,
right?
And I just love that whole aspect of just being by myself,
Right, right.
Hey, Lula Morehouse is on the
Lula,
thing today, so
yes.
We're kind of happy to bring you guys along today. Marty, again, I want to say thank you. And if you guys don't know, Marty and I have been roommates forever. We were
we have
in college. I wish our friend Veronica was on today.
Right.
We've been through these companies, and we had a vision a long time ago, and
we did.
Our vision is coming into full fruition.
Yes.
We wanted to have this mind-body thing going on, and we have that, mental health with medicine, and we're combining it, and we're doing it, and we're bringing it to the community to say, look, there's no difference between your mind and your body. It's
That's
all
right.
one. We're practicing this unison that we have to get it
yes.
together. You have to get everything together in your life in order to be healthy. So this
You're
show,
right.
I love doing it. I love the
Same here.
opportunity to see you. I have an opportunity to see the other physicians on board, and we're saying, hey, we're going to do great things for people of color, because
that's right.
One thing to hear about what's going on with our bodies and our minds for
Right.
someone, but to hear about your body and your mind for someone who looks like you, it just kind of hits a little different, and I
It
just want to
does.
make sure that people are aware of what we can offer and how you can help yourself and live a better life.
Yeah, I was just talking to a new patient as I was leaving, trying to walk out the office today, and she was even talking about, she goes, I'm scared to do this, but I know I need to. She goes, and I know that my mother and my grandmother and some aunts have mental health issues, but we're afraid because she kept saying, my mother kept saying, well, why are you going to see a therapist? You don't need to see therapist. You just need to pray. You just need to. And she goes, no, Mom, this thing is much deeper than us. And yes, I've been praying. And yes, I need to see my doctor, but I need some help too. And we want to help dispel those rumors and those generational fears that doctors and therapists, that we're not there to support you. We're not trying to put you on medicine. We only want to put you on medicine if it's going to help. And some of us, we have prolong this so long till sometimes medicine's the only way to get you out of that funk until you can get back on your feet with that. Dr. Allen, do you see that even in your private practice a lot of times where we're fearful of doctors?
Right. We're very fearful of doctors. We're fearful of medicine. And as a
Yes.
people, we tend to second guess and judge, and I tell people all the time, God put me in this place to help. I didn't wake up with a
Right.
silver spoon in my mouth to say that,
Right.
okay, I'm a doctor and I'm here. No, I was blessed to be in this position and I'm
Yes.
here to share my knowledge. If we offer you something, we're offering you for the better of your lifestyle. It's not
Yes.
because we're trying to get over on you. We're here. We're working in our community for you to do better. Mental health
Right.
matters. Mental health is out there. We have to
Yes.
recognize that it is a problem and we have to address the issue. It's that pink elephant in the room. It's that
That's
people do
it.
not want to see it and address it. You're like, oh, such and such and such is a 5150. And you're like, oh, okay. But we're not trying to get that person
That's
help.
right.
So we need to get them help. We need to just make sure that people know about the resources in the community. We
Right.
know that it's okay to say, I'm breaking down. I need some help. I
Yes.
need something to help me. So I am glad again, Marty, that we're doing this and that we can
That's
tell
right.
people about different things in life. And I want you guys to know that we're here for you and tell us what you want us to talk
That's
about
good.
because we have a lot of people of color who's willing to come onto the show and provide expertise to people and just with plain language so you can
Mm-hmm.
understand how things can go so you can answer your questions and feel comfortable when you go speak to your own private physician. So
That's
I'm
right.
glad we're
That's
doing
right.
this.
Same here, same here, and we're making a difference. And the two doctors are in the green room just nodding their head, talking about that's right, that's right. I see them. They back there testifying with that. But I'm so glad because you have really showed me the importance of bringing our physical health and our physiological health, medical health, and our mental health, and marrying that together. Because when we have good mental health and we have good medical health, that's just going to help make our lives that much richer and better. Too many of us are suffering in silence in the shadow of shame because we are too afraid to tell our doctors to go seek therapy or to get help. Stop being afraid. That's what we want to tell. Don't be fearful. We're here to help, not to hurt. And the advice that we're going to give you is only going to help so that you can live your best life. Definitely. So, Dr. Allen, let's bring on our guest today. Do you want to introduce our guest?
You do a great job with bringing them on. Bring them on because you know them now. You know them as much as I do as about that. I
Yes.
love your intro.
I love these wonderful doctors. I'm so proud to have them. She was here in LA last show, but she's back at home in that windy city of Chi-Town. But we are so glad to have her. She is definitely a health fanatic. We love her. She's doing great work. So none other than Dr. Jamie Horn. Dr. Jamie, how are you?
Hi. Hi, Marty. Hi, Dr. Allen. It's nice to be back. And I'm
Yes.
excited to be doing this from my home. And look, hopefully we don't freeze. So I'll be good.
Oh, it got cold back there in Chicago again?
Oh, no. I meant, no,
Okay.
it didn't. It's
Okay.
80 degrees today.
Oh wow!
I
Oh,
know.
wow. You got-
I have a
Just in
sleeveless
time.
shirt.
Dr. Horn, how was your Easter?
I worked Saturday night. So I got
Mm-hmm.
off Sunday morning and I spent Easter Sunday at home with my husband. My girls were out of town, but it was nice because my daughters and they were in DC. My husband and I were here, but we were able to watch church service online together. So that was nice. And then the rest of the day, I just kind of easy breezy laid around, watched Netflix, and ate.
I know that's right. Sometimes we just need that. It's a holiday, so I'm going to get my mind together because I got to deal with the other folk later.
Right, because I had to go to work Monday, so that's exactly what I did. Exactly.
Yes. Well, welcome again to the show. Always glad to have you.
Thank you.
And all the way from Lake Charles herself. You know, y'all, I've been getting lots of fan mail for Dr. Gisselle because she is just doing it because everybody's like, I love her. My mom, you got a fan in my mom and everybody, but all the way from Lake Charles, none other than Dr. Gisselle McKinney.
Hello, everybody. It's good to see you, Marty, Dr. Allen, Dr. Horn. Good to see you guys.
Yes. How are you?
I am blessed and highly favored. I can't complain.
I know that's right. That's right. She's taking us to church. For those who didn't have Easter service, you're about to get it here tonight.
Well, I didn't get it because I was working the whole weekend. So,
oh, no. Yeah, see, our work is never done. Our work is never done. Great. Well, glad that Dr. Allen, you want to kick off the discussion tonight?
Yes. I am happy to be here, even though I'm a fabulous 50.
Come on.
Fabulous. Maybe fabulous.
Yes.
And so, our topic tonight is one is near and dear to all of our hearts. We're OBGYNs in different parts of the city. And we just want to talk about women and women's health. And one of the things, are you hot or not? Or is just the menopause hitting you? Are you sweating? Because a lot of times, one of the things that people tend to do when you hit that 50, Jamie hates the saying, Dr. Horn hates that saying, 50 is the new 40. I embrace the new saying, 50 is the new 40, because I feel like a 40-year-old until the time I start grabbing a fan and start flashing over and talking about, is it me or is it you? Or is it anybody else out here? Then I'm going to blame it on thyroid, and I'm also going to blame it on my clothes. So tonight we're going to talk about, embracing yourself, embracing being 50,
that's good.
Enjoying that, the glow in your skin, and how can we help that? How can we increase your sex life, your sex drive, and be more vibrant about yourself? And so tonight we want to know if you're hot, if you're not. Let us know. How can we help you, and how can we help you to live a better 50 and above? Because when we were growing up, you used to look at your parents and 50 was old. You're like, oh my God, they're 50. So then now you're looking like 50. Oh, wow. What are you talking about? I can still touch my toes, things like that without cracking.
I hope so.
Right. Someday, so those are the things that we want young people or people of our age, even though I'm not 50, just to know about, because that's a part of us, and we need to embrace it. We don't go out there and not trying to compete with a 30-year-old. We have to understand being 50 is fabulous, and let's continue to be fabulous. And Dr. Horn, and I love this Dr. Gisselle Hawkins. I'm messing with you. We're going to speak about how to embrace it. What's out there? What is menopause? How can we do better with menopause? What's natural herbs? What's given to you over the counter versus, medicine that we prescribe? How does it affect our psyche? How does it affect our daily lives? And those are the things that we want to discuss, So Dr. Horn, let me bring you on.
Before you go there, Dr. Allen, no, I want to say that, a lot of times I had a lot of people say, well, Marty, you're a man, and why should you even be on this panel? But I want to invite you ladies, get your men on here, because men need to understand how menopause can affect the relationship and how we can be more empathetic when our women are going through menopause and what we can do to support them. So that's why I'm on this panel tonight, because we need to learn how to support one another, because we all go through problems. It might be menopause for the women, but it could be prostate for the men and some other things. So we need to be supportive and get a better understanding of all of our health. And men, if you want sex from your women, you need to learn how to and get all this information you can get from about this menopause and help these ladies out. Get them some cold water, ice, whatever natural herbs they need to get. If you want to get some, get on the line. Get on the line.
Where your hormones reside? Where your hormones reside? That's right.
I work around crazy people. Oh my God.
But Marty, it's also a good thing to bring them on the line because men also have decrease in their testosterone levels when they so they need to hear this too, because we have something for them too that increases their libido. So they need to get on the line, talk to us, and they can understand what's going on. But Dr. Horn, tell us what is menopause, Dr. Horn? What you think about this? Even though it's not me.
Even though it's not you or me. So what I thought we'd do is start with just basic definitions. What is menopause? Menopause is defined as not having a menstrual cycle for 12 months. So 1 full calendar year. And in the United States, that usually it occurs around age 51, 52. Perimenopause is the time frame that leads up to menopause, meaning that's when a woman's cycles become longer. They'll skip a month, they might become lighter. It'll be light 1 month and a little heavier the following month. And typically perimenopause starts around age 47, but it can start as early as your late 30s, early 40s. Associated with these menstrual changes, the most common symptom is hot flashes. 80% of women have hot flashes when they're either perimenopausal or menopausal. And hot flashes are, how I describe it, the 1 or 2 that I've had, you feel an internal heat. It's like all of a sudden you're hot on the inside and it just kind of radiates out. You not only have this heat, some women also start to sweat. Some women also start to feel anxious, and it typically lasts 2 to 3 minutes. Some of the other symptoms of hot flashes are mood swings. Mm-hmm. And what I typically ask my patients, what is your family saying around you? Are they calling you moody? Has your husband said anything? Are you finding yourself more emotional, meaning you'll watch a Netflix movie and you used to just, laugh through movies. Now you're crying all the time. That's what I mean by a mood swing. The other thing that can happen that is also a pretty common complaint is vaginal dryness. About 47% of women who are either perimenopausal or menopausal have vaginal dryness. And it usually starts out with decreased lubrication during intercourse, and it progresses to that. You'll feel those same symptoms, dry and itching, when not having intercourse, just throughout your day. Mm-hmm. And the reason people get that is because when you're going through menopause, your estrogen levels fall down. And estrogen helps increase the blood flow in the vaginal area, and it helps with the tissue of the vagina. When your estrogen level starts to go down, those tissues become pretty thin. And when that area has decreased blood flow, decreased estrogen levels, that can lead to the vaginal dryness, which can lead to the painful intercourse. So when women start to have these symptoms, it's important that you go talk to your doctor. A lot of women that we see in our everyday practice will say, oh, I've been suffering with this for years. This is just menopause. But there are things that can be done so you don't have to live with that. When you see your doctor, the first thing your doctor is going to ask you are, what are your symptoms? Make sure that you're able to tell your doctor about your menstrual cycle, meaning when was the last cycle? Are you having heavy bleeding? Are you having spotting throughout the month? Because there are different things that we do for those different workups. Also, if you have a history of fibroids or you are overweight, that can also play a role in your menstrual cycle. So when you see your doc, what your doc is going to do is take this history and do a physical exam, which would include a pelvic exam. When your doc takes a look in the vaginal area, women that are menopausal, the tissues tend to be a lot paler because of the decreased blood flow. The pubic hair tends to be pretty sparse. So just by looking, sometimes a doctor can let you know, yeah, it looks like you're menopausal. But to confirm it, there's some blood tests that your doc can do. And one that people always come in and they say, tell me, doc, I want to get my hormones. Well, what do your hormone levels mean? 2 tests that are really beneficial and help with this analysis are, one is your FSH, which tends to go up when you're menopausal, and your estradiol, which tends to go down when you're menopausal. So that's one easy blood test that the physician can do. There's some long-term complications, or not complications, but side effects that happen with having a decreased estrogen levels in our body. So that's why it's important to go see your physician. And if your doctor can help with either hormone or other things that we're going to talk about later in the show, it's something you should truly consider, because low estrogen in our bodies can lead to osteoporosis, which is thinning of our bones.
Oh, wow.
It can lead to joint pain. It can lead to balance and balance difficulties. Because I know for myself, a couple of weeks ago, I sprained my ankle. And a girlfriend of mine was like, "Girl, you going through the change." I'm like, "What are you talking about?"
Girl, yeah, you were going through the changes. No, don't try to act like you weren't going through the changes. Be real to the people.
Didn't have the hot flashes and
you had the hot flashes, people, mood swings, all that kind of stuff. She was in denial, like half all the other Black women.
Maybe the mood swing.
Maybe the mood swings.
But I noticed I was tripping a lot, and I was like, "This is kind of crazy." And she said, "You know, that's a symptom of menopause." Either I knew it and forgot about it, but when I was researching for this show, loss of balance is something that happens when you have decreased estrogen stores. And then the last thing that you see with decreased estrogen, when we have decreased estrogen in our bodies, unfortunately, our fat content goes up. Right. And we can get truncal obesity.
That middle piece, that stomach that don't want to go away, that side that your husband got to pull up to have sex, stays there. So we have to make sure that we control that. That is menopause.
Right.
I'm sorry.
That's another reason why you should get
and you
that
cannot exercise her away. She is like your friend.
She was there to say.
She is the string of pearls you never paid for.
Right. Well, what about those men that have to pull theirs that extra nest?
They're menopause too. All of them menopause and things of that nature.
Everybody menopausal together.
Menopause, they're just like, look,
right.
But, we have to be real about these are some symptoms, like Dr. Horn said. You can go to your doctor, your estrogen levels are low. You're hitting 50. When you were younger, you were swinging from the chandeliers, you were doing all kind of stuff.
Come
now
on.
You're like, I don't have the energy. I'm just not there yet.
Your hair can't even go like it used to.
Hair doesn't grow, even though Gisselle said I got creamy crack, I got like 5 strands. That is menopause hitting in, but don't tell nobody I have no menopause. So we got to understand that, the lack of energy is the difficulty in sleeping at night. Most of the time you feel that, I cannot really get a good night's sleep. You're flashing, your husband's there, your sheets are wet, you're taking off the stuff, you're putting on the stuff, you're doing all this other kind of stuff. And then people's like, this is not real. But if your husband has been there from beginning to end, we're not talking about that big belly that he has. And because, so we're going to say, look, you got that big belly, but I'm going to take this sheet off and on because I'm sweating. So we have to, as women, we need to embrace that there are going to be some changes. And how are we going to, deal with these changes in our life? We're in the Black community. We sit there and say, okay, I don't want to take no hormone replacement therapy. I don't want to do certain things. And the reason why you don't want to do certain things, because you heard bad things about them again. And so how do we, Dr. Hawkins, how are we going to address those issues of the, sleepless nights, the foggy brain? You know how people come to, oh my God,
memory loss.
Forgot. How many times now with this COVID stuff? How many of you guys? Don't let me say that. How many of you guys went to the car? I was talking to you the other night, Jamie. Went to the car, forgot your mask because you had to go to get something from the store. Then you forgot your purse in the car, but you got your mask on your face. Then you go back to the car to get your purse, but forgot your mask. And by that time, you just like, shit, I'm done. I cannot.
I forgot why I came.
Exactly. Just get the car and keep
going home.
I'm going home because I don't need to do this anymore. So I think that's one of the things that we need to figure out, how we can take advantage of this and how can we control this factor. A question earlier was, when does it go away? Normally when you hit menopause, it should last for about 7 years and your hormones should balance out.
Lord.
And then you should either you're going to be having vaginal dryness, no sexual drive or anything like that. And then that's where Dr. McKinney will tell you, what to do to get that back. How are we going to get that back? How are we going to get that Stella? How can Stella come back?
There are so many options out there for us to get our Stella back, our mojo back, and get our game on. So typically we ask the patients, what's your major driving factor that drew you to come to the hospital or to the office to ask us for assistance? And those who come and suffer in silence, I want to tell you, please don't do that. Your life would be so much richer and better if you decided to just get treatment or therapy. There are so many options, including estrogen, which is hormone replacement, or non-estrogen types of treatment. Dr. Allen said that this treatment, your menopausal symptom can last for 7 years, but some people never stop. So that means that they're going to need some therapy probably for the rest of their life. The majority of us, though, only go for a short duration of time, 7 years possibly, and some go longer. But most of us need a little bit of assistance. So we're looking at, if you have a uterus, giving just estrogen only. If you have a uterus, then we give estrogen and progesterone. So if you had a hysterectomy, estrogen alone would be perfect. If you have all of your organs, estrogen and progesterone are needed together. Some people come in complaining about their lack of sex drive, not necessarily vaginal dryness, but they having those hot flashes and they just do not feel like sexy enough and they have no desire. They could go months without initiating intercourse and they're married. So estrogen test is another form of form of hormone replacement that would be beneficial. Estrogen test is estrogen and testosterone, which boosts your sex drive. There's also injections. You can get estrogen and testosterone injections, but those tend to have high highs and low lows. That some people have to get those injections twice a month in order to feel what they call normal. I do notice that when people started getting the injections, they become more dependent on it, and especially if they get the testosterone. And there's some side effects to just about everything and how your provider doses it for you. And then there are other things that you can get over the counter, such as St. John's wort, black cohosh. You can also get from your physician a prescription for clonidine, which is a blood pressure medicine, but it works great for people who are having prolonged problems with hot flashes. It's a low-dose blood pressure medicine that causes vasodilatation, which helps you from the hot flashes. And then there's the over-the-counter like estrogen. This is a plant-based estrogen that binds to the estrogen receptors to help you decrease some of your menopausal symptoms. So you have options. Some people also need some physiotherapy, some feedback in order to get themselves back on track. And I always say, if you don't use it, you lose it. If you're not sleeping and you're not taking care of your mental health, the body will follow. So if you're not sleeping because you're stressing out, you got mood swings, you're sweating all over the place, and you are a mean summer gun, your rest of your life is going to follow it. Your hips not going to move the same way, and Stella won't be getting her groove. Sorry.
Right. Stella.
Go ahead. Gisselle, one thing you didn't mention, have you been using cannabis with your patients? I've had a couple of patients tell me, no, not trying to be funny. No. Telling me the gummies, like help them sleep. And
my patients have told me that thing, the cannabis cures everything, including cancer. They are taking it for everything, for insomnia, mood swings, rashes, menopausal symptoms. They even taking it for COVID. I don't know that it works. I haven't read any studies. But there is supposed to be a cure for all of dermatitis. They're using the cannabis creams. There's a cannabis tea to help you sleep. So I imagine it would work, because if it can make you have munchies, I guess it could make you go to sleep too.
I think some of the things that people like Gisselle said, that people take weed, you're gonna go to sleep with anything, but hemp has become a part of everyday life. People are putting it on their legs, they're putting it everywhere just to try to make themselves better. But one of the things I find out, what we offer in our practice for women who have vaginal dryness, there is also what we call a CO2 later, which is the Mona Lisa. Most of the women who come to my practice complain about, I have vaginal dryness, sex is not fun anymore, and that I need some extra lubrications. It's okay to use lubrications, but sometimes you have to use what we call water-based, Don't try to go to your thing. Your man think he's going on. He's going to get some Crisco oil, think he got it going on. So you guys have to make sure you're going to use KY jelly or something like,
and don't use Vaseline.
No Vaseline.
No
what about coconut oil?
No coconut oil, Marty.
I'm just asking.
You have a nut allergy?
You listen, you talking about a yeast infection and a vaginitis that we may take weeks to pick it up.
Okay, just asking. See?
Fire in the hole for real.
Right. Find a hole. But we got to make sure that, women, you have to talk to your partners about
That's
this,
right.
Because everybody's out there, we dating 50-year-olds. Some of us trying to get our groove back and trying to date a 30-year-old. The things you used to do when you're 30 years old, you can't do that in your 50. Rhonda, no, we can't use no Crisco, girl. We're not trying to find no grease up in that vagina. But we do have some better things for you.
But this
such
is
as estrogen creams. You can use some estrogen creams. And another thing that people tend to do, you want to change your body pH, especially those naturals people, they want to say, if I change my body pH and use the black cohosh, we have to be very careful about that. Black cohosh, like Dr. Hawkins said, that's an estrogen component. So if you have a uterus, you just cannot take that by itself. You must talk to your doctor about things like that. So you have to make sure that you talk to them, because if you get some vaginal bleeding, it's going to take all that away from you. Because sex after 50 is a different ball game than when you were 30. It takes, and you and your partner have to be, I know this is not a sex show, Marty.
Yes,
but
it is.
You and your partner have to be in one accord.
That's right.
To understand that, it takes a little bit longer. The vaginal walls have to be a little bit more lubricated, and that it has to be a process now. And then especially if you haven't had a period in a year, what makes you think that your sexual drive is going to get there? You need to get back and have that sexual drive. You have to do a little bit more romance and dance before you can just come hop in the bed, have your thing, and keep on. But once menopause hits, you got to make sure. Menopause hits, you got to make sure the moon, the stars, and the trees, all
everything
that stuff
aligned
line up before you can do anything.
But that's so true, because even not to cut you off, Dr. Allen, we're talking about men now in their 50s and stuff. We're now talking about erectile dysfunction and that type of thing. So he got to take his medicine. She got to take her medicine. Everybody got to just take some medicine or get something on. So
that's truly, like Dr. Allen has bioidenticals, and men are some of the biggest users because their testosterone level drops as they get older, and their sexual dysfunction. A man will stop taking the blood pressure medicine and risk a stroke and a heart attack to make sure their penis works. So that Dio-T works great for their low T syndrome.
Right. And
that
is true. So bioidenticals is what you see behind me. Oh, wrong thing.
Other side.
This side.
Oh, there we go. Make a plug.
Bio-T is actually what we use in our office. It's a bioidentical hormone. And so what that does, like what Dr. Horn said in the beginning, we come in, we draw your blood. And the difference between me giving you a synthetic estrogen that everyone has, like an estrogen and progesterone, we actually draw your blood and to make sure that the hormones that we give you are specific to the hormones that you actually need. So therefore you come in, if you need estrogen, if you need progesterone and testosterone, we will able to pellet you with that. You'll be amazed. Like Gisselle said, I have men that come in my office. You got this 60-year-old that's chiseled down. He's chiseled, his chest looks good, his face, his chin is squared out, because I done pumped him with almost 1,600 pellets of 60 milligrams of testosterone. That increases his libido. It does everything. So women, if men are out here doing this and getting themselves together, you need to take a stance and say, hey, I need something to enhance my libido. I need a little bit more estrus. Let's get together and talk about how we're feeling about this. You should not, again, suffer in silence, mentally, physically, or emotionally. Talk to your friends about this. My sex drive is not there. I'm not sleeping very well. My muscle tone and my muscle mass is gone, where you put your dress on and the lower part of your arm is shaking and jiggling. You're like, wait, hold up. What's going on with my tone? So those are the kind of things that we need to make sure that we talk about. And once you increase estrogens, that'll help you out. And a testosterone too.
I'm coming to see you on Friday.
Marty, you know, I'm gonna hook you up though too. We're gonna chisel that chin out and get that face
Come
up
on.
so you can have and make sure.
When?
You know,
What does testosterone do for women?
Testosterone increases their libido. So one of the things that happens is that once you get older, your testosterone level as well as your estrogen level decreases. You need that testosterone estrogen balance in order for you. Hey, I don't know what that is. Sorry about that. Testosterone, that ain't me, y'all. Oh, there. Thanks, Marty. You up there talking to me. I thought you was getting excited over the program. I heard all this stuff in the background. I was like, I don't know.
You thought that was my heavy breathing.
Right?
Today.
It's Wednesday, y'all. Look, we just happy we got some good summer weather coming, and we about to be out this COVID, thank God, soon.
COVID. And then let me tell you, our thing has really picked up because the sexual drives have picked up. People have an opportunity to be with their partners all the time.
Right.
And so then now, you know, you're having more sex more than often. And let's be real, ladies, when you're 50, you know, one round is good. When you asking me for two, I'm like, check mark.
This is true. What's the saying? I may not be as good as I was when I once was, but I'm good once as I ever was.
Right.
Oh, now that's good. But it's true. We have to pace it. Be like, now we can romance that. We gonna just go. We'll be like Richard Pryor in come on now. I'm losing it in Harlem Nights. He said we're gonna have sex real good for about 15 minutes and go into a comatose sleep.
Yes.
15 minutes is a little bit too long. A good 5 minutes is pretty good for me. How we work, you know.
And let's think about it. In your 30s and 40s, when you were raising kids, you didn't have time for another reason. So you didn't have sex as often as you did in your 20s before you had kids. So you spaced it out for another reason. You were exhausted. The kids would never leave you alone. You didn't have any time in your own personal space to have, you know, your kids are always running in. Now in your 50s, your kids are older. They better not touch that door when the door is closed. And you're enjoying when you get yourself under control and you have your hormones in balance, you're able to enjoy a more healthy sex life. So when we ask the question, Dr. Allen, you started by saying what we can do to get the community interested in hormone replacement rather than these fears. The fears are based in what's called medical apartheid. There's a book actually that talks about how medicine has betrayed the Black community by doing unsanctioned studies and things on us. So we carry that baggage with us. However, there are people like us that have transcended some of that can tell you, yes, we know the history, but I'm telling you, this will help you. So trust me, help me help you to be able to get you through your life, to get to a phase where you can still touch your toes. You can still sit down and cross your legs. You can enjoy a healthy sex life. You can go on and not sweat all night and sweat all day and be miserable. Life is to be enjoyed and lived. So help us help you to live the best life possible.
That's good. That's good.
And like I said, and Marty, when they come to you also, like we said, for mental clarity,
yes.
When you're getting older in your 40s and 50s, your mental, you know, you're sitting around and saying, why isn't this clear like it used to be when I'm 20s and my 30s, and how you sit around and then you forget all the things that you talked about 10 minutes before. So we have to understand that hormones will kind of bring that back to you.
Yes.
One of the things that there's a study by the WHO organization early in the game, people stayed away from certain medication that was an estrogen progesterone combination because they felt that they were going to get breast cancer. As long as you are working with your physician, as long as there's no risk factors, hormone replacement therapy is good for you. We also have the difference between you, Marty, and us is the fact that you don't have any estrogen. So when we hit 50 and our estrogen decreases, it increases our rate of heart attack, cardiovascular disease. So these are the things that we are trying to prevent. So therefore, we ask you to come on in. I don't want to suffer and die of a heart attack because I refuse to take a medication. So if you're afraid to take synthetic estrogen, progesterone to get breast cancer, that's where the bioidentical comes from. And that's that key word, bioidentical. It's a plant-based. It comes on. It's specifically for you. We give you your estrogens back. We give you your testosterone back. And we even give you thyroid. So your metabolic metabolism takes off again. So you can actually maximize and optimize yourself so you can feel good again when you're in your 50s. This whole process is feeling good about yourself, looking good, the glow. So you don't have to do the Botox, the fillers, and things of that nature, where you can just have the natural glow of your skin. The vaginal dryness is there, the decrease in sweating, all that stuff goes as long. Like Dr. Horn said before, the bones cracking and popping. How many of you guys, you sit in a chair for 2 hours, right? You get up and you got to think about that first. You got to, okay. Your mind said, I'm at the door, but your body is still in that chair.
And you have to,
it's like, hold on, I'm not there yet. So hormone replacement therapy works in a lot of avenues with your bones, your heart, and everything. And just, again, mental clarity. And men has to understand too, you have midlife crisis, you have menopause as well, you get mood swings, night sweats too. When your little Peter don't go up as high, you're just as
no,
evil
she did
as
not
we
call
are.
it a Peter. Oh my God.
Okay, it's not a Peter. When your little Marty don't go up as high.
I did. Oh my God.
So, question here. We're going to talk about the little Marty later. It says, is there anything to look forward to concerning?
Yes. Yes. You know what? Yes. No period. No period. No cramping. No pregnancy. Girl, yes. You can get your groove on anytime.
Anytime.
Yes.
And I think that's the thing about, like Gisselle says, but let me give you a tip of that. Dr. Horn to tell you, so you hit menopause. Not saying you're in menopause, Dr. Horn, but she got her husband tapping on her shoulder on a regular basis now because she don't have no excuse.
But you're right.
Anybody home?
Paula makes a great point, because when we hear menopause, especially for men, we think that life is over for our significant others. And you're not saying, and I love that perspective. You're saying life is not over. It actually just began. Right. So this is how you keep it going. And this is how you now can live the best life possible.
That is
because
correct.
Just because we're 40, 50s, life is not over. My best life is still yet to come.
Yes. And incorporate exercise. I can tell you
just getting ready to say that.
Let me just say this. I said this last time. Jamie is an exercise beast. She can do so much because she keeps moving. But if I sit down for 2 hours and I want to get up, I feel it because I don't do my workouts consistently. This girl will bounce up in a minute and keep it moving. However, she may trip on herself now, but but
Paula,
you have to keep moving, and otherwise you won't be able to touch your toes. Estrogen and no estrogen.
Yes, that's good.
Exercise, though, it does a couple of things for us. Especially if you add strength training, it helps protect you against osteoporosis. So exercise also releases endorphins, which will help with your mood. So I can't speak enough good things about exercise.
Right.
And again, I'll say it again, like I said, every time we do this show, you don't need equipment. All you need is some tennis shoes. The weather's getting nice. Put your headphones on and start walking.
But that's so good, because it's so good for your mental health, which changes. And I love this, talks about your medical health as well. We have stopped exercising, and that's what we have to get back doing, because that's going to change the trajectory of our lives with doing that. It's simple, getting the blood flowing, getting oxygen in our lungs, getting the body movement. That's going to help alleviate a lot of the problems that we're having. And I'm talking to myself now and getting rid of this. But I'm not.
And tell your kids, because United States has the largest pediatric obesity rate. You have to take your kids. There's no reason. I don't think any other country has my 600-pound life where people are actually over 600 pounds.
Right.
That's a U.S. thing. You know, I always wonder when I watch the show, who is paying for all this food? How can you keep eating like that?
And then we'll say we can't afford a therapist. If you cut back on the food, you can't afford your therapist.
Because you definitely need a therapist if you eat like that.
Yes.
You're covering up something.
Because you're going to be tired from working with that.
That's your gym membership. That's your new shoes. You don't even have to have gym memberships. That's just walking around the block and all that. And there's so many things. And that's what I love that we all do every time we come in here. We talk about the basic things. You don't have to be filthy rich. You don't have to have this 6-figure income. You can be making $1.25 or whatever and still get out there and exercise, get you a bottle of water from your own house, and just get out there and get movement in your body somehow.
Right. And that's what we talked about before. Like Dr. Horn said, when you're exercising, you're decreasing the amount of your fat. When you decrease the amount of what we call your peripheral estrogens, you will slow the process of menopause, because what happens is that the bigger you are, your periods shut off. And so that's why you see people who come to our office, they have what we call PCOS, or their difficulty in being pregnant and things of that nature. So if you start earlier, then menopause will actually delay. It's also a familial thing too. So you need to talk to your family. When did your mom go into menopause? Was there also a surgical menopause from having surgery? So when someone has a hysterectomy or things like that, that's called a surgical menopause. And so we kind of put you in menopause because we move your ovaries and we take away your hormones. However, there's also a thing, premature menopause, that Dr. Horn was going to talk about earlier. Premature menopause happens before the age of 40s or 30s, when it's supposed to happen, and that can be due. You may have some women here who have lupus or any type of autoimmune disease where it attacks the ovaries and it puts through the menopause. So you have women who are earlier in their age, in their 30s and stuff like that, who cannot have kids, and then they're going through menopause and hot flashes. And we need to have this conversation on what's going on with our bodies. I can't lose weight. You're running, you're exercising, but that middle portion is still there. You have a hormonal imbalance. Something is going on in your body, and we need to maximize those hormones. And it's called optimization. You need to get to a point where your body is in one with one another, and then therefore you can have a good life. There's nothing wrong with going into menopause. There's nothing wrong with embracing it, because again, look at our hair. Our hair falls out. But if you, again, maximize your hormone replacement therapy, either it be through natural causes or synthetic causes, these are the things that will help you live a healthier life, decrease your incidence of cardiovascular disease, and also your relationship with your partner will be a lot better. And
there's so many options now. They even tell us that we can extend the use of birth control pills if you don't want to go on quote unquote hormone replacement therapy. And that has a breast cancer saving effect to it. It also decreases your chances of uterine cancer. So it's got some pluses to it. But you have options even with hormone replacement therapy. You have pills, creams, vaginal suppository, films. You have pellet therapy. There's a list of all kinds of treatment options you have, both hormonal and non-hormonal, that you can use. I think it would be a shame if you lived a miserable life. You could make some changes that would make your life so much better.
And I think one of the things that, like you're talking about the foods, Dr. Horn is a vegetarian, edamame, soy products, vegans. That's why you see when people, what did I say? You were a vegetarian?
Wait, I'm a dirty vegan. I'll eat some cake.
She'll eat some cake and a pie and a piece of pork on a good day. And put some green stuff on top of it. Okay, I'm gonna leave that there. Girl, but wait.
Pull it back.
Yeah. She gonna eat some turkey.
No.
You gonna eat some barbecue. Come on, Jamie. Anyway, we're gonna go there.
Tofu.
You got no tofu, but you the edamame and the soy products and things. Go ahead, Dr. Horn. I'm sorry.
I was going to say, Dr. Allen's correct. Soy products. It's a natural plant estrogen, and there's soy milk, there's soy cheese, there's soy. I just got some soy yogurt. There's soy frozen yogurt. There's tons of options. Yes, you can't overdo. So I'm not saying that's something you should be taking in every day, but a little edamame instead of some chips. Some tofu sometimes instead of chicken nuggets, you can make tofu nuggets. So making some of those small changes in your diet can also increase your soy intake.
Yeah, and that dragon, or not that one, is that dragon fruit? Is it that they make some of that other stuff? I've had some vegan tacos.
Oh, jackfruit.
Jackfruit, that's it, jackfruit. And it's really good. It
is good.
It is. I'm liking it. And the firmer tofu really does take the taste and substance of sometimes the meat. So, changing your diet, we have to. Listen, I'm trying to live a long time now because I want to enjoy my retirement.
Right. You got to enjoy.
I want to get my Social Security that I paid into.
That we done paid into. Folks trying to kill us off. But I know I love that with talking, because we have to now start and think more healthily and have these conversations. So that's why I'm so glad we are doing this and continue to do that. But go ahead, Dr. Allen.
I forgot my train of thought, Marty. I got caught up in your thing. We got 2 minutes. I think
one thing. I'm sorry, Gwen. One thing we haven't talked about is smoking. Women who smoke, they tend to go through menopause earlier because the tobacco interferes with the estrogen. There's nothing good about smoking. So If you are smoking now and you're in your 20s, please stop. If you're
Yes.
smoking now in your 50s, please stop. There is nothing good about smoking.
Yes. All bad things come from a cigarette.
Oh,
All bad
wow.
things.
Right.
And a cigar and a pipe too. People are substituting cigars and
Yes.
pipes. And you want to know why I know? Because we opened a cigar bar and it's full of people.
Oh, yes. Oh,
I think
yes.
one of the things that we also need to stress is that it's okay to openly talk about menopause. It's
Yes.
okay to openly
Yeah.
talk about the fact that, you know, you're gonna have to layer your clothes in the earlier nights. Okay. Sometimes you start off, you may have on a sweater and a jacket, and by midday, you're gonna have to take off your layer of clothing. Some women you'll see walk around with a little fan around them, and it's okay to say, okay, I'm flashing, I'm blushing, but to embrace that. Don't be
Mm-hmm.
ashamed of it. Don't, think that this is something that's wrong with me. And then there's ways to correct it. Like Gisselle said, hormone replacement therapy is out there. Keep the glow on your skin, the collagen buildup, and things like that. The estrogen is very important. I can't say that enough, that we have to make sure that we balance that estrogen and progesterone. Muscle mass. We want to continue as you get older. Before you sit around and say you can go walk and you look good, but now you touch your legs and they're a little flabby and soft, and everybody going to try when you get 50. Oh, a man wants something soft. Yeah, they want something soft, but they want something that's actually toned. And so you got to understand that working out, you got to take your hormone replacement therapy and just keep everything nice and tight. You don't have, just because you're getting older and 50, you don't have to look saggy and raggy. And that's one of our biggest points that we're telling you tonight. And talk to your partner. I would tell you, talk to your partner.
That's
and let
good.
them know how you feel, because a lot of women, once you hit 50, your man is probably popping the blue pill, which is the Viagra, and you sit at home doing nothing, and you're not enjoying sex at 50 anymore. And you need to understand why you're not enjoying sex at 50. You're not enjoying sex at 50 and above, or when you're in menopause, because there's a decrease in estrogen in your body. So how do you replace that estrogen? With the soy products, if you want to do natural, with the pill synthetics, the Primprose and things like that, or bioidentical hormones where we pellet you. And so then therefore you can say that I have my options, I have my choice, because you're not out there trying to compete with a 30-year-old. I keep saying that. You guys know I probably have some issues trying to compete with a 30-year-old, but I'm not trying to compete with that 30-year-old. I just want to make sure that, I am living my life, and I'm vital at 50. I can do everything at 50 that I was doing in my 30s. I think.
Right. Well,
And you're not alone. One thing that I think this is important to know, that you're not the only person going through this. You're not the first. You're not going to be the last. And truly, if you talk to some of your girlfriends, they're going through the same stuff. Because I never would have known balance was a thing until I started talking to another woman who was about my age. So talk to friends. Find out what works for them. It might work for you as well. And go, like we've been saying over and over and over, please go see your gynecologist.
Yes. So and it's never too late to make a change in your life. Think about the oldest female bodybuilder is Ernestine Shepherd. She's now a Black woman, 84 years old, still doing bodybuilding, but started it in 1995. So she was in her 60s or early 60s when she decided to become.
She was retired.
Yes. Yeah, she was retired. Her and her sisters decided to make a pact to do weightlifting, running, change their diet because they had a family history of cardiovascular disease.
Wow.
Unfortunately, her sister died younger, and she's still into bodybuilding at the age of 84. So you can make a change. It doesn't have to be the last minute. And she didn't start off that way. Each small step gets you closer. And my sister was a couch potato, and she went from couch to marathon. So it helped change her life too. So you can go from there. That's how it works.
But look how it changed not just their physical body, but they changed their mindset.
Right. Definitely.
And that is the problem. We have to stop the stinking thinking and change how we look at ourselves and look at the life and look at the productivity of our lives. And I hear you, Dr. Allen, you said, hey, 50s is the new 30s or 40, whatever it is. Wherever you are at, It's a new beginning, and we're about to open everything up. You have a fresh start once again to claim your life back so that you don't have to suffer in silence any longer.
Right.
Definitely.
What
Go
was
ahead,
that?
Dr. Allen.
Yeah, I don't think well, like you guys are saying that no more suffering. Let's talk about it. Let's get it out. You know,
Yes.
and it's okay. I embraced 50, 3 years ago or something like that. And I think I look damn good to
Come
be
on.
above my 50s, even though the COVID has hit me again and I gained a little 20 back, but
Girl.
again, your skin looks good, everything like that. Let's embrace this. Let's talk about it. Let's just have healthy
Yes.
lives. Let's make
Yes.
sure that every time that we come together, that we are doing something that's positive in the neighborhood, that we're showing people that even though I'm an African American female, I'm gonna live. I'm gonna beat statistics. I'm gonna live till I'm 80. I'm gonna live till I'm
Love
90.
that.
I'm not gonna live till I'm 50 and 60 because I'm beat down because of obesity and diabetes and hypertension and drug abuse. I'm going to embrace my life. I'm gonna live healthy. I'm gonna get everything that's entitled to me, and I'm gonna make sure that I live my life to the fullest. And
That's
that's what
right.
we have to do. And again, I can't stress mental clarity. When
Yes.
we get to our 50s and we need something going, you have to make sure your mind is completely, in control of your life, that you have just a mental clarity and everything else is put to the side and that you understand what your purpose is, your purpose driven life. I probably
Yes.
stole that from somebody, but again, we have a
You
purpose
did.
to do something like
You did.
driven, right?
You did.
I think
Yes.
purpose driven. That's why I said it.
So, Marty, what do
Yes.
you think your audience would want us to talk about next? That's something Dr. Allen had asked before.
That's good. That's good. You know what, audience, while you're in there, first tell us, hit those likes, hit those shares, host some watch parties tonight afterwards. This is too good for this not to get out. And then please put in the comment section some of the other, we need a part 2 of this conversation. Cherie, thank you so much. What are some other topics? This is also, April is
I think we
also
need to
child
talk about.
abuse.
I'm sorry. Oh,
Go
child
ahead.
abuse.
Child
I think-
abuse. Go ahead,
No, I'm
Dr.
messing
Allen.
with you. I think one of the things that we need to talk about relationships. I know we're all obstetricians and gynecologists, and most of the time that we talk about either child abuse, domestic violence, and things like that, let's talk about nurturing family relationships
good.
and things of that nature, and how that fits into this whole picture, the mind and the body. You have to have a healthy relationship with someone, your God, your family, your whatever, in order
Right.
for you to have a healthy life. That's my thing. I don't know. You can
Well, I know COVID has adversely affected any
Yes.
relationships that have had troubled marriages, have been totally decimated. If you have a tendency toward domestic violence or child abuse, they have skyrocketed.
Yes.
Level of depravity has gone to a level of biblical proportions during this lockdown period. There has been no checks and balances because a lot of school districts, kids weren't going to school. So when things were
Right.
happening to them or happening in their home that affected them, the depression and the relationship with food changed.
Yes.
People are gaining weight. People are being abused. And we're missing it till it becomes completely severe. So that's a good topic we can talk about. But, anything, family relationships would be a good one. But yeah, we could go on for hours on that one for sure.
Definitely. And one of the other topics I think we could definitely address too, April's also Sexual Abuse Awareness Month. And there's so much sexual abuse that goes on. And I think a lot of times we don't understand the levels of sexual abuse that happens and how we talk about that. And even domestic violence. I hear you on that. We need to talk about sex and COVID. Thank you guys. Thank you for sharing with that. So these are all great topics, and then we'll definitely explore. So, hey, you guys keep sending the topics. We're going to address them, and we appreciate you so much. So I know the hour goes by so quickly. This was great. I learned a lot. As a man, I learned a lot about menopause. Let me tell you something. I know that. Dr. Horn, last words, and how do we continually get a hold of you?
You can get a hold of me on social media. I'm on Instagram and Facebook. I'm at Family Christian Health Center in Harvey, Illinois. We have our grand opening on the 15th, the ribbon cutting for the Maternal Child Health Wellness Center. So I'm excited about that. My last parting words are to women in your 50s, you are not alone. And if you are suffering, you don't have to suffer, and you definitely don't have to suffer in silence.
Love that.
Definitely.
Dr. McKinney.
Well, you can find me also on Facebook and Instagram. I'm located at Lake Charles Memorial Hospital for Women, and you can contact us at any time. Like Dr. Horn said, don't suffer in silence, but think of this. It's never too late to make a change in your life to live the best life possible. So let's start today.
Love that. And Dr. Allen, of course, my co-host.
Again, Marty, thank you. Thank you. I can be found, I guess, some days, Gardena Women's Center here in Gardena, California. You guys drop me a line, social media. Text me, or you could just come by the office. We have a lot to offer for you, and just come and see us. And one of the things, let's go back for what we started off in the beginning with COVID. There is a vaccine site at Centinela every Tuesdays and Thursdays, so you guys can go log on, get your vaccines. Because I also still, as we started off, I need everybody to be vaccinated again so we can stop wearing, well, we will never stop wearing masks, but we will get back to some normalcy. And then also we won't have any hot flashes. No, I'm joking with you guys.
Hey, Kim.
You know, but again, thank you for having us on. It's been great.
Yes.
Awesome.
Well, if you're looking for a vaccination site in Lake Charles Memorial Hospital is having a free vaccination site. You don't have to, it's open to anyone over 18 and over. So you can come get vaccinated there too. They're using the Moderna this time.
Okay. Awesome. Well, listen, we've had another amazing show here with Mental Health Matters with Marty, and definitely with these amazing doctors, aka house calls. We came in your house and gave you this amazing information. So ladies, please take the advice of these amazing doctors here, and we will be back in 2 weeks for another edition of House Calls. Again, my name is Martina Sellers. I am your mental health hygienist. Please check out my website at mentalhealthmarty.com. And if you're not a part of our podcast community, we definitely want you to become a part of that. Check out my podcast at everywhere that you listen to podcasts at Mental Health Matters with Marty, and become an I Matter member by subscribing and texting I Matter to 855-717-1272. Again, we don't want you to continue to secretly suffer in silence in the shadow of shame, but we want you to speak up, speak out, and live. But as always, remember to enjoy your life. Until next time. Enjoy your life.